Hey guys, Janus here with my latest video. In this session, I'd like to share some key aspects of blood vessel growth and how it relates to size gains. Additionally, I'll be discussing a spiritual successor to the oscillator. In my time studying male sexual organ health and growth, three key elements repeatedly make themselves known: nitric oxide, VEGF, and PDGF. Today, I'm going to talk about these three substances that are so often mentioned in relation to one another, how they work together, and how to exploit their production. Starting off, as blood moves through a blood vessel, it travels over and through an almost grass-like growth called the glycocalyx that spreads out over endothelial cells and thereby exerts a shearing force, which is sensed through a series of protein structures embedded in the walls of endothelial cells. From there, the signal then travels intracellularly and affects cellular metabolism. In this way, endothelial cells are capable of responding to external forces and reacting accordingly. In this case, by explosively releasing bursts of nitric oxide to kickstart the vasorelaxing process. From here, smooth muscles begin actively cycling calcium intra and extracellularly, which increases the rate of nitric oxide production by endothelial cells. By this point, the blood vessel in question is already significantly more dilated than it was before experiencing the increased level of shear stress caused by the faster rate of blood flow passing through its channel. After vasorelaxation has occurred in response to the heightened production of nitric oxide by endothelial cells indirectly experiencing shear stress through the glycocalyx, a secondary process kicks off known as endothelial cell migration. It has been shown for decades that endothelial cells will travel along the inside of blood vessels in the direction of flow, and that when flow peaks, they will begin burrowing outwardly in all directions. This is why the arterial system resembles great bushy masses whenever all the surrounding tissues are removed. However, before this migration can occur, endothelial cells require that two benchmarks be met. The first is an increased level of nitric oxide production, and the second is increased levels of shear stress. Once both of these factors are present, endothelial cells will begin releasing a protein signaler called vascular endothelial growth factor, VEGF for short. VEGF is a growth factor and signaler that tells endothelial cells to start moving in the direction of flow and to begin multiplying. Additionally, it is crucial to the formation of capillaries. Whenever endothelial cells are exposed to VEGF, they begin to form tight, whirling spirals, which literally bore into the surrounding tissues like living drills. As endothelial cells drill through the surrounding tissue, they form a type of spiraling scaffold, which will be crucial later on to the process of muscularization. Sometime after endothelial cells begin drilling through the surrounding tissues, they begin releasing another growth factor crucial to the process of blood vessel formation, known as platelet-derived growth factor, PDGF for short. PDGF is known as a mitogen and chemoattractant, which is a really fancy way of saying it causes cellular division and encourages vascular tissue to rapidly migrate toward areas where the levels of this protein are high. As endothelial cells begin releasing PDGF, they also begin rapidly multiplying in response, which increases the rate at which capillary beds form. Beyond this effect, PDGF causes another truly breathtaking phenomenon known as smooth muscle migration. As stated prior, whenever endothelial cells form capillaries, they do so by turning themselves into living drills that bore through the surrounding tissues. On top of that, they form a path on which smooth muscles can travel. Whenever endothelial cells begin releasing PDGF into the surrounding tissues, smooth muscles attach themselves to the capillary tubules and then begin spiraling around its skeleton in the direction of PDGF production. So what exactly does this mean for PE? Whenever I first started talking about shear stress-based exercises, one of the common retorts was that capillary growth and formation was not the same thing as penis growth. However, when we factor in that capillaries exposed to shear stress release chemoattractants known to encourage capillary bed muscularization via smooth muscle migration, things take an interesting turn. What we come to discover is that shear stress is the most effective way to cause penis growth, far superior to any other form of stimulation we might try and exert on our sexual organs. Towards this end, I began experimenting with a variety of motions and techniques based on what I already knew about blood vessels and pre-existing methods. After a great deal of trial and error, I've landed on a technique that can reliably exert an immense amount of shear stress along the internal surfaces of the sinusoidal capillaries within the corpora cavernosum and give truly impressive morning erections. I call this technique the Displacer. Before I begin, it needs to be stated that this technique should only be performed by men that can properly perform the Vascular. This is an advanced level exercise. Without sufficiently developed blood vessels, it would be incredibly easy to enter a state of overtraining. I repeat, do not perform this exercise until you have sufficiently developed blood vessels. Additionally, this exercise is designed almost exclusively to cause PDGF release from the platelets and PDGF generation by endothelial cells. This is not a standalone exercise and would be best paired with the Vascular before any other techniques I've discussed. Lastly, to prevent overtraining, the Displacer should not be used in the same exercise session as the oscillator. On the board here, I have drawn a coronal cross-section of the male penis, specifically the top end of the corpora cavernosum. As many may already know, the corpora cavernosum consists almost entirely out of muscularized sinusoidal capillaries and spaces. Additionally, that endothelial cells and the glycocalyx can be found lining their internal surfaces. Therefore, they are capable of responding to shear stress in a manner near identical to a blood vessel. This meaning the increased generation of nitric oxide, VEGF, and most importantly, PDGF. In past videos, I explained how sinusoidal spaces are ideal for causing oscillatory, or more apt to say, spiraling shear stress based on their design. I will now explain how to effectively exploit that fact. As you can see, I have created a bottleneck here in a heavily engorged but non-erect penile shaft. Additionally, I have drawn arrows showing blood being displaced from ahead of the bottleneck to behind it. Lastly, that the blood from ahead of the bottleneck be forced through the narrowed section of the penile shaft. It is this narrowed portion here where the magic happens. Whenever blood vessels are exposed to shear stress, they near universally produce nitric oxide, which kickstarts vasorelaxation. However, when this occurs, the amount of shear stress experienced by the blood vessel conditionally lowers. By creating a bottleneck, however, it is possible to mechanically impede this process, thereby restoring the heightened level of shear which we need to increase growth factor release, this being PDGF primarily and VGEF secondarily. Based on my notes and current research on the topic, I have found higher levels of shear stress to be ideal for causing both platelet and endothelial cell-based PDGF release/production. What this means is that all of the cells which become exposed to the higher level of shear occurring in the bottleneck will begin releasing and producing a dramatically higher level of growth factors. Furthermore, that the blood in the corpora cavernosum itself will be encouraged to release PDGF. This means that in order to fully exploit this phenomenon, the bottleneck must move up and down the shaft, effectively exposing as many cells within the corpora cavernosum as possible to this higher area of shear.